Medical Mariner, Inc.
Ladies and gentlemen, coming to you live from our Norfolk studio, home of the Atlantic Fleet, Medical Mariner, Inc.
Hello and welcome to today's episode of Medical Mariner, Inc. This was initially going to be the episode about PA school, but after getting into my interview with Ms. Kandee Griffith, the Director of Graduate and Professional Admissions for the College of Healthcare Sciences at Nova Southeastern University, where I am an alumnus, turns out we're going to need a couple episodes on it. So this is the first of two, and I hope you enjoy it. We have our first guest on the Medical Mariner, Inc. podcast. This is Ms. Kandee Griffith, the Director of Graduate and Professional Admissions for the College of Healthcare Sciences at Nova Southeastern University. I went to their Jacksonville, Florida program for my PA school. She has over 20 years of educational experience and began working with healthcare students in 2013. So welcome, Kandee. I really appreciate you coming on as my first guest.
Thank you so much. I appreciate the invitation.
What is it that you enjoy most about your job as the Director of Graduate and Professional Admissions?
In my role, I am responsible for roughly 34 to 37 programs within the College of Healthcare Science. What I enjoy is the opportunity to help people make their dreams come true. We all have personal goals in our life, and sometimes we have paths where we can go straight into what we want to do, and sometimes we have a detour. So it's nice to be able to sit down with people and outline this is what you need to do in order to reach and accomplish that goal that you want in terms of your career, and to be able to see students who put in that hard work and the application comes across my desk and I'm able to offer them an interview. So I really enjoy making a difference in individuals' lives. And in this making a difference, it's a long-term difference. You come in, you're a student, but when you graduate, you're going into a career. And now you're giving back as well. And then you have that opportunity for individuals to shadow you, opportunity for you to do a reference for someone, an opportunity for you to point someone back towards NSU because your experience was good. So sometimes it's a full circle where our students leave and then now they become our external recruiters because of that positive experience that they had with NSU.
When you're looking at somebody's info coming across your desk there, what are you looking for in an ideal PA candidate?
Wow, that's a loaded question. We always are wanting to make sure the student is academically eligible. So that's going to be number one. Do you meet the academic requirements? Then looking at the entire academic history. How did you do from your freshman year all the way through your senior year? Looking at the science courses. What science courses did you take? Did you take them as part of your academic semester, or did you just take them in the summers? Balance that. Why? Because the rigor of the PA program is high. It stretches you beyond what you've done at the undergrad level. So we need to know that you can handle rigorous academics. And if you're only taking 6 credits and then 9 credits, but you're always taking your science courses by themselves, then there's a strong possibility that you might not be able to handle the academic load of 5 to 7 to 8 science courses and being in class for 40 hours a week. So trying to make sure that students can handle the academic rigor. What does their academic history look like overall? What courses did you make C's in? Did you only make 1 C, or is there a pattern? You know, you took 3 organic courses and you have a C in all of them, or maybe it wasn't organic. It could be you took physics, you took calculus, and we're starting to see that the higher the level of the course goes, the lower your performance goes. So wanting to make sure that the student has stable academics history. Everyone's going to have blemishes. We all have to learn how to adjust to college. So that freshman blemish year is just life. That's not going to impact anyone unless they flunked their courses, then of course that'll impact them. But then the non-tangible things are what's on the application that shows motivation to become a physician assistant. Outside of going to school and getting a degree, what else did you do to show that this is the career you want? Did you shadow? Do you have a job in healthcare where you're being exposed to physician assistants? Have you done mission trips? What are you doing to align yourself with working in healthcare? But more importantly, what are you doing to show that you have an understanding of what a physician assistant does? And so that's the kind of things that I'm looking for, trying to ascertain, does the student understand what does a PA do? What time have they put in to understand their profession itself? And then academically, where do they fall in terms of their ability? Are they a consistent AB student or are we a BC student? And if you're operating at 75, that is going to be a challenge for you to be considered at NSU. If 75 is where you always are hovering, that almost will be flunking at NSU. You need a minimum of a 75 to graduate from the program. So that's why we're looking for that top tier student academically, so that they do not come in and immediately flunk out of the program because they haven't learned how to operate at a higher level.
Yeah, I remember that from when I was in PA school, that we were all like, man, I missed one question. I can't believe that. I need to go back and study more.
True. You gotta stay focused on the end result.
Absolutely. For someone who is considering PA school, what do you think are some of the important things they need to do to get ready? I believe we've already kind of touched on that some.
We did a little bit. I think the first thing is, if you're an undergrad, you want to make sure that you're speaking with your advisor, letting them know this is my next level. After I complete undergrad, I want to go to grad school and I want to go through the PA program. They need to understand what are the prerequisites. They need to take the admissions booklet, sit down with their advisor and say, in my plan, I need to make sure that I take all these courses because I'm trying to prepare for this program and I want to make sure that I have all those courses taken. So making sure that they're aligning themselves appropriately so that they can take the courses that they need. And then understanding a profession is important. Aligning yourself with someone who is a physician assistant. That could be applying to be an MA, applying to be a scribe. That could be volunteering, your organizations like Volunteering Medicine, where you have exposure to not just PAs, but nurse practitioners and MDs. You're working in a volunteer environment and you're able to see the collaborativeness of how healthcare works. So although health experience is not a requirement for admissions, it's a requirement for an applicant to be able to explain their understanding of the profession. You want to be able to talk about it genuinely. I volunteered for 60 hours and this particular person was working in dermatology. These are the kind of patients we saw, things of that nature. Understanding that the PA is not better than the MD. Sometimes students will communicate things such as PAs get more time with the doctors, and so that's why I want to be a PA. Well, every medical office has a set amount of time that the professionals are going to spend with that particular person. And depending on the nature of your visit also determines how long the PA will spend with that person as well. So it's important to be able to understand that the PA role is different depending on the specialty. Whether you're an ER PA or you work in neurology, what are you doing? That is going to determine the amount of time you spend with that patient, not just I'm a PA and that's what happens. So understanding the profession is just critical. You need to know what you're getting into. And then you also need to be honest about how much can you handle, because the academic curriculum is 18 plus credit hours every semester. And in the undergrad, that's not what you do. And so are you able to handle that increased rigor as well? So, being honest with yourself, can I do this? And then understanding it's temporary and you're going to have to give up some things. For 27 months, you got to make a sacrifice so that you can have the career that you want. 27 months to be able to do what you want to do for the rest of your life is just a small sacrifice.
Absolutely. That second semester of PA school is certainly an eye-opener, but then once you get through that, you're like, man, I can do anything. So
that's true.
When you talk about folks going from undergrad or things like that, do you think it's better for someone if they go straight from undergrad into a PA program, or is it maybe if they take a little time off and do some other things in between?
I think students can be successful either way. The PA program has a price tag attached to it. And so I think you have to look at the return on the investment. If you know that you're going to need to work because you're going to need to have extra funds when you're in PA school because you're not going to be able to work while you're in PA school. Then a gap year may be advantageous because financially you need to pad your bank account to be able to do it for 27 months. I think the bigger picture is if you come straight out of undergrad to grad school, that you have to understand that the academic, how you studied in undergrad is going to change when you go to grad school. And so you have to be able to make that switch mentally. Everyone is making it in that first semester. So it's not rocket science, but it is just an adjustment. But I do believe that you can be successful either way, but you have to be able to make sure that you understand the path that you're on so that you can be successful. Now, for some students, you and I both know this, you can remember when you were in your class, it took some students 6 months to acclimate to the program. And then we only got another 9 left.
Yeah.
And then for some students, they struggled the entire time, but they still got through the program. And so how well do you deal with adversity is so important, because in this PA program, you're fighting with yourself to make sure that you can do what's expected.
I totally agree.
You know, it's a lot. I
Yes,
think,
it is.
yeah, you asked me earlier, what do I enjoy the most? And now that I'm kind of sitting here, you know, I remember so much about when you all would have your test. I knew when it was test day. I mean, you know, my window sits towards the parking lot, and I would see the students gathering in pods in the parking lot. And you can tell when it was a great test and everybody did well, everyone's going and jumping in their car, they're coming back with Starbucks and whatever they want. But when it's not a good day, it's like people are just standing in circles outside, waiting for the opportunity to come back in and find out how well they did or didn't do.
So you could tell when we were all taking pharmacology tests.
Every test, when the tests were really hard, it was like, OMG, this is going to be a rough day. Rough day.
Yeah. What do you think would make somebody want to choose the NSU program? What makes NSU stand out from other programs?
One, students have 4 opportunities with us. Although you have to submit 4 different applications, you have 4 opportunities to be able to attend NSU and be part of our program. And I don't want to say put out, but NSU educates a large number of students to become physician assistants. And so when you, a lot of our students are extremely successful in what they do. And so the way that our program is structured, it's small and it's intimate. Our faculty ratio will vary per campus, but we're looking at, you know, on the average 9-to-1. And so our faculty can really focus on teaching our students the core skills. You know, the book knowledge is important, but at the end of the day, the PA profession is an application-based profession. And so that application-based part is important. How do the faculty go about teaching you to be a healthcare provider? How do you take what you learned in the book and then apply it on a daily basis long term? And I think we do an exceptional job with that. I think the way that we set up the labs and the experiential learning allows for our students to have a level of confidence when they transition into their clinical year. I believe that our supervision and how involved our faculty are, our clinical team are when the students are in their clinical year also allows for that further success. Our students do not have to find clinical rotations. We have them set up, and then we have a preceptor for every clinical rotation. But in addition to that, we have a clinical team that's monitoring what that student is doing when they're on their clinical rotation so that we can give that student feedback so that they can see how they need to grow. We've also have instituted additional learning resources to prepare for the PANCE exam because you want to be able to go through our program and get that -C. And so we have definitely instituted resources to assist our students in preparing for the PANCE. We have standardized our end of rotation exams, and we're using the PAEA rotation exam. So now our students are being asked questions at the level that is similar to the PANCE exam. We also create a timing for our exams to allow students to get in that mindset that when they get to the PANCE, they know how to be able to answer questions rapidly, but also to be able to select the correct answer. So a lot of what we do is preparing our students to be competent healthcare providers, but in that competency, we're taking the time to make sure you have the skills that you need. We can't prepare you for every type of medical diagnosis, but we can prepare you for what do you do when that person comes into the room? How do you go about asking them questions for your AP? When you get those answers, how do you unpeel that onion to figure out what's next? What blood test are you going to order? What test are you going to order? How do you communicate with your MD, your supervising individual, may it be a nurse practitioner, may it be an MD, to make sure that you're on the right track? Who are you collaborating with to ensure that you're providing appropriate health care? And so I think we do a really good job with that. Our faculty are hard on our students at times. We do what we call an OSCE, which is that experiential lab, where our students are pretending to be a PA, and then one of their classmates is pretending to be a patient. And they utilize that time to be able to help them gain confidence and gain skills, but they're also helping them learn how to think on their feet. Because medicine doesn't really have a book. You have to be able to hear what that patient is telling you. You know, when you're asking questions up, someone's giving you all the answers, and then, you know, this goes in this box, this goes in this box, and now I think that I can go down this line because everything that they're telling me is leading me to believe that this is what's wrong.
So using that info to kind of take all that, and you start off with this set of differential diagnoses that's a million, and as the questions come in, you get it narrow and narrow till you get down, okay, it's one of these 5 things and we're going to figure it out here.
Yes.
And you guys did a great job of teaching us how to do that.
And I think that's important. You know, critical thinking is important. In anything that we do, critical thinking is important, but in medicine, critical thinking is extremely important. And I know that our program puts a lot of focus on the critical thinking part. No patient can just walk in a room and bam, you're going to automatically, know what to do. You're going to get stumped. And when you get stumped, what do you do? How do you go about still providing quality health care to make sure that you can figure out what's going on? And I think we do a great job.
You do.
We really do. I believe in the product. I do. I've seen students graduate. I see the students working. I actually have been in the ER and had Nova grads in there. I've also been serviced by Nova grads from another NSU, and I feel good. I know that what we do is yielding a quality individual to go out there and serve as a healthcare provider. And it's a field that you grow in. When you come out fresh and brand new, you're not going to know any more than what happened in your clinical year. That's the only experience you're bringing to the table. But you've been trained to be a healthcare provider. And in any environment you go in, you always are going to have to be trained for that culture. But you're coming in with the core skills to be able to see any patient and to be able to know what to do. We focus on primary care. And that's a majority of what individuals need. But our program also allows for our students to be able to go into a specialty environment if that's what they want to do. So that flexibility in how we teach our students is really, really good.
Yeah, it's interesting that you brought up the primary care piece. I got into emergency medicine originally when I was thinking about, we're going to be doing all the high-speed ER stuff, and it is shocking how much primary care we do in the emergency room because people just don't have the providers to meet that need.
That's true.
Is there anything that you would like to see changed in American healthcare? And if there is, what is it and why?
Well, it's an interesting question. I think right now the biggest issue, since we are, I hate to say still coming back from COVID, because COVID's been 4 years ago, but it seems right now it's hard to get an appointment. It's like an appointment could be for almost 2 months out. Mm-hmm. And I think, I don't know, we don't have a shortage per se, but I feel like there has to be a different way for providers to be available. That is the biggest challenge I see, is that availability to get in and get an appointment. And then when you do get the appointment, you wait longer than who you see. So, you're waiting 45 minutes to get in to see a provider. And then depending on your issue, it might be a 5-minute conversation. I might spend $35 for my copay, but I'm only getting 5 minutes with you, but I may have waited an hour to see you.
Yeah.
So that availability definitely is something that I would like to be able to get an appointment quicker than 60 days out. And even with students, when they need to do their immunizations to prepare for our program, I used to start it April 1st. Now I've pushed it back almost 45 days. I'm having to start it significantly earlier than before because, unfortunately, due to the amount of time it takes for a student to get an appointment, and because we know the average time is 2 months, we have to set up our students for success and we have to start earlier.
I agree with you completely. That's why I've started doing some concierge medicine as well.
That is wonderful. Have you seen on Netflix the series called Royal Pain?
I have not.
That whole series is concierge medicine set in the Hamptons, and one of the main characters is a PA.
Well, I will have to check that out.
You have to.
Well,
So that just jumped in my mind. It's a drama, but you get to see the PA in action. And also, they show how when she goes in, she's having to explain what is a PA. So you also get to see that as well.
Yeah.
That people aren't always familiar with the position, and her having to explain her role.
I'll check it out. And one final question. Do you think that we're ever going to see a program develop that bridges the experienced PA into a MD-DO type role? Or do you think they're always going to remain separate like this?
I believe they will remain separate, but I will say this. If a student came through and they complete the PA program and they were interested in either our MD or DO, we do have the opportunity to connect them with that admissions professional so that they understand what would they have to do additionally. Are you missing any, requirements or anything of that nature? Now, the DO does have a bridge program. And so, a PA could go through that bridge program. And then once they complete the bridge program, they have that opportunity to be admitted directly into the DO. We've had a few PAs leave NSU and they just pursued the MD route maybe after 5 or 6 years. So we have an alumni that I just heard recently just started MD school. And we also have an alumni in the Fort Lauderdale area. She came in, she got her PA degree, and then she also got her nursing degree. So she has both her MSN and her PA degree. So she has both licenses. So I don't know how she utilizes it. Like, I don't know if they hired her. Maybe they probably hired her as a physician extender, because then that allows for her to operate in both realms if necessary.
Yeah, I'm not sure how that particular piece would work out. Is there anything I didn't ask about that you think we should include?
Yes, a lot of students aren't going to get accepted, so I'm just going to be transparent about that. There are approximately over 300 programs in the country for the PA program profession. I think it's important for students to access the PAEA directory and to review all the programs in the country. Create an Excel spreadsheet, and you look at every program in the entire country, and you look at their prerequisites, and you have to be honest with yourself, and you need to figure out which of these programs in this list of 300 do I meet all of the requirements and I fall in the area of which they consider competitive. And then you need to focus on applying for programs in which you can get accepted in. Just like when we did undergrad, we had this list of, these are my reach schools, these are the schools that I feel pretty confident I'm gonna get a yes in, and then these might be my backup schools. That same thing needs to be done. But the research needs to be done when you're looking at graduate school. It's important to do the research, understand how many seats are in the programs that you're applying, understand how many applications that they receive, because then you have to understand what percentage of students are going to get interviewed. So if a program has 50 seats and they have 500 applications, that's very competitive. On the average with NSU, well, for Jacksonville, we will range anywhere between 850 applications to 1,500 applications for 60 seats.
Wow.
So it's very competitive. But so you have to do the same work that you would do if you were applying for a job. Let PA school be like I'm applying for a job, and lay down the requirements for PA, lay your resume next to it, and make sure that you can check all the boxes. And those are the schools you need to apply to. There are lots of schools that do not have requirements that require to take the GRE. There's some schools that look at the last 60 credit hours, and there's some schools that look at cumulative. You need to know what's best for you. If you're not a good test taker, then maybe you need to look at the schools that don't require the GRE. If your GPA wasn't as good as you wanted it to be when you graduated, maybe you need to look at the schools that only look at the last 60 credit hours. You're trying to set up yourself for success. So that's what I would say. And if a student goes that route, they will increase their opportunity to be accepted, because now you are applying to schools that you know you meet the requirements, bar none. Also, it may take you 2 times or 3 times to get accepted, and that is not a reflection of you as an applicant. It's a reflection of the competitiveness that exists for applying to PA school. If it's what you want to do, you give 100%. Sometimes it takes us multiple times to get to the end result, but not to be discouraged because you didn't get picked the first year. If this is what you want to do, you throw your hat back in the second year. But during that time between the first year and the second year, you need to be able to show, how did you grow? What changed in your level of motivation to become a PA? You got extra shadowing hours, you got extra medical experience. Something has to change. It can't be you submit the same exact application the second year and nothing's changed. If the first year it didn't get you an interview, guess what? So resubmitting it the second time might lead to the same exact results. So again, we have to have introspection about ourselves. What is it that I need to do differently to increase my personal competitiveness? Make sure you're picking individuals who, when they do your letters of recommendation, number 1, they know how to spell physician assistant and it does not have an apostrophe. Number 2, they know what a physician assistant does, so that when they write the letter, they can write the letter to show that you have transferable skills that can be applied into the medical profession, and you can be an asset in our program, and that you have the ability to be taught, and that you have the ability to be a competent healthcare provider. Sometimes students are extremely smart, but then they show up and they can't even articulate why they want to be a PA. So that's the other thing, is you need to be able to communicate that as well. You need to be able to talk about, why is this the profession you want to be? So that means you need to have interview skills. You need to know how to talk to people. And so you want to practice that as well. In this particular generation, we have a lot of individuals that have never worked. They've never had a job. So then when they get into PA school, it is the first time that they have been in a position where someone is telling you what to do, and they are expecting you to do it. And when you don't do it, they're going to give you feedback. And so for some of our students, the clinical experience that first couple of months is a challenge, because they've never, ever been in a work environment and they do not understand the culture of a work environment. And now I need to learn how to do this. So sometimes that can be a challenge. So I would tell people that try to get some work experience, do something, because those skills are essential to being able to be successful long term. But that's one of the things I've noticed recently, is there are more and more applicants with no work experience. When you lack work experience, sometimes it's growing pains to understand group work and collaboration. And also, how do you swallow your pride and keep your mouth closed when someone says something to you that is just out the way? And sometimes you can be right, but it doesn't matter whether you're right or not. You still have to do what's asked of you, and you can't take it personal. And that's the other thing, is you have to learn that you don't own the company. It doesn't belong to you. You're showing up, you're completing the task, and that is what you're there for. And sometimes it's not fun. It's just not. But the experience is an essential component to you making those 2,000 hours that you need to graduate. So being able to separate the personal from the professional. I am here, I have a goal, I need 180 hours, let me show up every day. This person may not be the best preceptor, but I'm learning, and that's life. Because in any environment, we're going to have difficult personalities. And so that's the thing that I can say is sometimes lack of having work experience means that those individuals have not had an opportunity to be put in a difficult situation that they have to maneuver on a regular basis and learn how to work with a variety of different personalities.
And PA school is definitely a difficult situation.
100%.
Okay, that's it for today's session of Medical Mariner Inc. Thanks for listening. Originally, I was going to cut this in with some of the other material I had on PA school, but since Kandee came in and gave us such an excellent interview, we're going to have to make that a second episode about PA school. Thank you again, Kandee, for coming in and talking to us, and I appreciate all you listeners out there. Feel free to leave me comments. You can like, you can subscribe, and you can shoot me an email at medicalmarinerinc@gmail.com. Thank you for listening to Medical Mariner Inc. Medical Mariner Inc. is written, produced, and hosted by me, Paul Stewart. If you wish to make suggestions for content, leave me some comments, or have anything you would like for me to know, you can email me at medicalmarinerinc@gmail.com. Thank you for listening. To support the show, please give me a 5-star rating on whatever platform you listen on, like, and subscribe to the show. Thanks, and I hope you have a good day. The background music, Perspectives, was created by Kevin McLeod at incompetech.com. It is licensed under the Creative Commons by Attribution 4.0 license. The website from which the music was downloaded is http://creativecommons.org/licenses/by/4.0.